Today's topic is sulfonamide. First of all is introduction. Sulfonamides are the first successfully synthesized antimicrobial drugs. They are firstly synthesized, or you can say firstly synthetic antibiotics. Mostly, as we know, antimicrobial drugs or antibiotics, they are mainly obtained from living organisms such as fungi, mainly fungi. So sulfonamides are drugs which are synthesized in the lab. They are not obtained from the living organism. That's why they are known as first, firstly successfully synthesized antimicrobial drugs. They are sulfur-related group is present in the sulfonamide and mainly used for the treatment of bacterial infection and fungal infection. The term sulfonamide, why it is used, it is mainly employed as a generic name, as a common name for the derivatives of para-aminobenzene sulfonamide. This para-aminobenzene sulfonamide is the basic nucleus which is present in each and every sulfonamide, which is also known as sulfanilamide. So all the derivative of sulfanilamide are known as sulfonamide. Sulfanilamide is the basic nucleus which is present in each compound, and there is difference in substitution and side by groups. That's why many derivatives have been synthesized and formed which come under the category of sulfonamide. Firstly, the sulfonamides are mainly discovered by the scientist Gerhard Domek in 1939, for which he got the Nobel Prize in Medicine. Gerhard Domek firstly discovered the sulfonamide from a dye called prontosil. Prontosil is a dye which on breakdown give a active compound which is sulfanilamide, which has antimicrobial activity. These antimicrobial are effective against pyogenic bacterial infection. Pyogenic means pus related or bacterial infection in which there is a exudation of the pus. So these antibiotics are effective for those type of infection. Structurally and chemically, as we see the structure of sulfonamide, they are related to the para-aminobenzoic acid. They are white in color and crystalline compound, crystalline powder, and sparingly soluble in water. And they are weak and form salts which are more water soluble than free sulfonamides. After introduction, let us go towards classification, as we simply take the classification of sulfonamide on the basis of its duration of action. First is short acting. Short acting, that is that their duration of action lie between 3 to 8 hours. Example: sulfadiazine, sulfadimidine, and sulfacetamide. Then is intermediate acting, where duration of action lie between 8 to 18 hours. Example is sulfamethoxazole. There are many examples also, and I am here giving some important drugs which are mentioned in your syllabus. So there are also more examples in these categories. Then comes to long acting, whose duration of action is more than 35 hours. Example: sulfadoxine, sulfamethoxypyridine, sulfadimethoxine. Topically used, then come to topically, which are used on skin surface. Example is nephenide, sulfadiazine, sulfacetamide. And then comes to ulcerative colitis. Ulcerative colitis, example is sulfasalazine. That comes to the mode of action. Sulfonamides are competitive antagonists of para-aminobenzoic acid, which is known as PABA. The compound PABA is essential for the synthesis of folic acid, and folic acid is an important nutrient which is required for the growth and reproduction of the bacteria. If its synthesis is interfered or inhibited, then bacteria cannot grow or survive. So sulfonamide act as a competitive antagonist. Competitive means they compete for PABA and itself bind to the enzyme which is responsible for the synthesis of folic acid. And due to binding of sulfonamide to the enzyme in place of PABA, the folic acid is not synthesized. Hence, bacteria did not grow and reproduce. That's why we can say sulfonamide reversibly blocks the synthesis of folic acid and have bacteriostatic effect. Then come to uses. Nowadays, sulfonamide are mostly used in the treatment of UTIs, means urinary tract infection, which are caused by susceptible strains of bacteria. Some uncomplicated urinary tract infection, such as caused by E. coli and other bacteria, can also be treated by using sulfamethoxazole and trimethoprim in combination. Both these drugs show bacteriostatic effect when they are administered separately, but if they are administered in combination, they will give bactericidal effect. Bactericidal means killing the bacteria, and bacteriostatic means inhibiting the growth of bacteria. Sulfamethoxazole is an antimicrobial drug which is used for the treatment of urinary tract infection, bronchitis. Bronchitis means inflammation in bronchus, in bronchioles, and prostatitis, inflammation in prostate. Sulfamethoxazole and trimethoprim combination can be also used in the treatment of encephalomyelitis, inflammation in the encephalitis means layers of the brain, and together with azithromycin, which is an antibiotic, it is also used in combination to treat ocular toxoplasmosis. Similarly, sulfadiazine SDZ, it is used in the prophylaxis and in the treatment of infection caused by pneumocystis carinii in case of pneumonia, and particularly in the patient who already suffer from AIDS or who are immunocompromised. In those patients, sulfadiazine is used for prophylaxis because these patients are highly prone for pneumonia infection caused by pneumocystis carinii. There are some sulfonamide which cannot be absorbed from GI tract, such as the phthalate sulfathiazole, succinyl sulfathiazole, salicyl sulfapyridine. These are the drugs which are used in the therapy of intestinal infection or ulcerative colitis, inflammation in colon, ulcer or inflammation in colon region of the intestine, and enteritis, inflammation in intestinal region of the GI tract. Similarly, sulfacetamide sodium can be used topically. Topically means on the surface of the skin for the treatment skin or in the treatment of eye infection or in such as bacterial conjunctivitis, eye infection which is caused by the bacteria leads to the inflammation in the conjunctiva region of the eye. Then comes to emollient form, which contain 10% of sulfacetamide and 5% of sulfur, is used in the treatment of acne in adolescent age. Silver sulfadiazine is again important sulfonamide which is used in the burn treatment, in burn therapy, in the form of 1% hydrophilic cream. These are the uses of the sulfonamide and introduction of the sulfonamide. Later on we will discuss this compound individually, their individual nature, structure, chemical properties, physical property, uses in detail. Then comes to the references, which are as follows. And thank you.